Yeah, in terms of medication, um, I, I think again, like when we talk about like the symptoms and the causes of anxiety are vast and you never know where it's coming from or what it all
Mm.
entails. I have found I entered into our field still being anti-medication because that was what I was when I was prior to being a therapist. And feeling like, we could just pray hard. Again, I was like 27. So we could just pray hard and try harder and then we're gonna feel better. But I do find for some of my clients, especially those with what we call like complex trauma, where they've had long-term things happen, they have a lack of safety that's happened since they were young, where they don't feel that security like their parents have been with them and care for them and will comfort them. And then traumatic events, I do have quite a lot of clients who are not able with like talk therapy or like kind of normal therapeutic interventions to feel any sense of relief. And for my clients, like we'll try it over time, like we'll give it a shot for a good 6 months or like 9 months, and we'll see how we can help them outside of medication. But at times they could take medication for a month or two and really recover physically in a lot of ways,
Mm.
and then choose to continue or not. But if they chose to not continue, they'd be able to approach their mental health with more confidence and more assurance that they actually can feel better.
Mm.
So that's how I will talk about it with clients, particularly Christian clients who struggle with the morality of taking meds, basically. Um, we can look at it not as a crutch, but like as a jumping off point, to
Mm.
start the recovery process. And some people stay on their meds for a long time. But I tend to evaluate that with my clients and check in and see how they feel, especially if they've expressed moral concern about it. And anyone that comes in my office that's like, I will never take medication, it's never going to happen. I'll be like, okay, like I'm going to let you know what your options are and we'll talk through it. But they'll never feel pressure from me personally,
Mm.
because I definitely understand the morality of not depending on medication. And again, this is for like anxiety. I'm not talking about like schizophrenia. like
Mm.
like there's specific mental health diagnoses where medication is the only way to regulate the mind, because it's almost a physical issue. But when it comes to anxiety, it's so holistic. It's so like mind, spirit, heart, trauma, body, that you can approach. And that's true for depression too. You can approach it from different perspectives and try different things, and different things are going to help with different clients.